This paper was called Understanding the Principle of Consumer Choice in Delivering Housing First. So for a bit of background, Housing First is quite a well-known model in the system right now in terms of how we address the issue of homelessness. Housing First refers to the idea of providing people as quickly as possible into stable, affordable housing of their choice. This is in contrast to older models that required people to have some sort of recovery before they were able to access housing out of homelessness. So that might be something around substance use, about mental health services. And Housing First says that actually if we provide some stability around people's housing, that helps them address their other conditions. And so this paper was a piece in which we were doing a broader study that was evaluation of a Housing First program for women. That program was designed because women and gender diverse people often have particular needs in their journey of homelessness. This could be things like being more likely to be trying to leave a violent relationship or trying to sustain or regain custody of children. And so in looking at this program and in doing our background work around Housing First, we noted that this idea of consumer choice was already one that was sort of conflicted or challenged within the existing literature and existing evaluation of Housing First programs. There are several principles of Housing First. Obviously, the immediate access to housing without preconditions is the number one principle. But the second principle is consumer choice of housing and choice of services. So that brings up two important issues. One is around location and quality and type of housing. And then the second is how services are delivered to people, how they come into their space, and what requirements there might be around those services. So to do this research, we talked with 7 program participants. We talked with 20 other service providers, people delivering Housing First, or people who referred individuals to Housing First programs. And we also talked to 4 program staff and managers. And we talked all about the model and the outcomes, but this paper was a particular analysis around that idea of consumer choice. This study was conducted by a group primarily out of the School of Nursing at Western University, and we were provided funding to do our analysis of the project by the Sisters of St. Joseph. In talking to the people receiving service in this program, delivering this program and other similar programs, there are 6 important things that we noted about consumer choice in Housing First programs. The first is, of course, the constraints of the housing market. And this was 2 different findings. The first is just the general housing supply. So we know that in not just high-income countries, but globally, we have a housing supply crisis. And that means that even folks with a lot of resources and a lot of money face limited options in terms of what they can access for their housing. And so this is the same for Housing First programs. Those delivering the program might be trying to find space within other social service agencies, within social housing, or within the private market using things like rent supplements to increase what an individual might get from their social assistance. So in the context of housing supply issues, then consumer choice is going to be limited as well by what's available in the market. And the second finding around that is to do with geography. And so often there is also geographic constraints around the affordability of housing. And as people are finding their way out of homelessness, they're maybe dealing with other things as well. And there may be reasons why they want to be in a particular area, such as access to other services, or there might be reasons that they're avoiding a particular area, such as trying to get away from some people that maybe they don't want to see anymore. And again, with the constraints in the housing market, programs might not be able to deliver that degree of choice around where in a city housing may be available for the people they're supporting in their program. The third thing that we learned about was about the idea of assertive engagement. So Housing First programs, an element of them, the third principle, is to provide individualized support to help people sustain their housing over time. These supports should go out to where people are living, and they should be flexible in terms of time and in terms of the degree of support that's offered. Now, this becomes a bit of a challenge when you're delivering a program because the program might feel like they have a responsibility to ensure the tenancy of the individual and therefore have some preconceptions around the types and degree of support that's provided. Now, that becomes challenging if the resident themselves has a different perspective around how much support they would like or they would need. And in this case, our program that we were evaluating was using this sort of assertive engagement where they would reach out to the individuals. If there was access to a phone, they would call, or they would knock on doors and check in with people. That worked for most of the cases, but in some cases, residents then asked the support provider not to keep coming and not to keep, quote unquote, bothering them. So if we're following the idea of consumer choice, they have the right to make that choice. However, if that individual then subsequently struggles with their landlord, isn't paying rent, or has issues, for example, with other tenants in the building, that leaves the organization in a bit of a bind in terms of their responsibility to help sustain that residency. So that was a tension that we heard a lot from our providers in this case. So the fourth thing we heard a lot about, and this wasn't necessarily from the providers of the program we were evaluating, but was from the 20 participants who were providing other programs, it's the idea of the type of housing in which these Housing First programs are offered. And so that's the sort of tension between a scattered site model or a congregate living model. What I mean by that is a scattered site model would be using primarily the public market in terms of what housing everyone else has access to. A congregate sort of model might be accessing those housing programs that are delivered through nonprofits or through the city's housing program. So those might be social housing buildings, supportive housing buildings. A lot of the organizations were facing pressure to use scattered site only in terms of delivering their Housing First models. And that was under the idea that if we do that, then we're not putting pressure on already overstretched social agencies and social services, but we're actually tapping into all of the housing that's already available in the community. The problem with focusing or even requiring a scattered site model is that if people wanted congregate living, then they didn't have that option if the program only delivered scattered site. So there was a pressure for many to do scattered site, but that went against the idea of consumer choice. The fifth thing we heard a lot about was that the person who is providing the support has a lot of power over the individual. So it's really important, particularly in hearing from the residents of these programs, that the service providers, the housing support workers, really come to them in a sort of position of humility, of openness, of working together. Because really they were in a vulnerable position. Many of the individuals in this program had not had successful tenancies through a variety of other programs, and the Housing First felt almost like a program of last resort. And in that case, the worker really held their tenancy in their hands in a lot of cases. And the sixth and final thing we heard about is that sometimes the individuals accessing the program themselves put some preconditions on their housing. So while the model says there's no preconditions required, sometimes the people who are accessing the program were saying, well, I'm actually going to wait and take care of these things, such as medication access, sober living program, something like that, before I'm going to follow up with you on my housing. So in the case of all of these 6 challenges, what's important to think about is how we talk about and how we measure fidelity of Housing First programs. So fidelity means how well the program is meeting the model. And what we were learning is that sort of taking the simplistic idea of this program is meeting fidelity or not meeting fidelity can be really challenging, where a lot of the elements of the program delivery are outside of the control of the program. The housing market is the obvious example of that. And so what we thought was important in our recommendations, firstly, is that we do be as true as possible to consumer choice. And so that means not asserting ourselves on individuals who are not ready to receive the level of support that we may think that they require. It's still their choice about how much support and when and how they get that support. Secondly, of course, is doing our best to offer a variety of housing options for people. But in measuring fidelity then, it's important for us to not just say the program is or is not meeting fidelity, but to be specific about how or why. And so if we're saying, there are elements of consumer choice that we are able to meet here, but there's elements we're not. And so that might be that we only had 2 housing options available to them. And we learned that one of those options was actually one they'd already had a bad experience with. So essentially, we could only offer 1 housing option. And that shouldn't be thought of as a failure of fidelity of the program. That's more of a failure of fidelity of our systems. And so it's important when we think about consumer choice, firstly, that we actually do our best to support that consumer choice, which can mean things like not imposing the idea of a scattered site model on a program because individuals themselves might want to live in congregate settings. But we also think about how we declare and speak to the broader systems issues that might be the struggle for that program in terms of meeting the consumer's needs. So to conclude, consumer choice is still an important principle in delivering Housing First programs. However, in tight and constrained housing markets, this can be challenging. But what we can do as programs is we can just be very clear about the things that we were able to control, the things we were able to do, and where we weren't able to meet consumer choice and why. And by outlining the why, that allows us as a broader collective of researchers and service providers and activists to target and think about the priorities of what we need to change in the system so that these Housing First programs can do the work that we know is important. This paper came out in 2023, and of course, Housing First programs are moving quickly and evolving and have really gone global since that time. So in terms of the work that we need to do next, I think it would be really interesting for us as researchers to do more work with Housing First programs to explore how they are finding ways to work around the really drastically difficult housing market to make things work for their residents. So what are the tools and the tricks and the opportunities that they're taking to find housing where seemingly no housing exists?